Good morning. We're here to talk about a new policy for our campus called Smoke Free Freedom. So, smoking is probably the single most harmful thing you can do to your health, and it's hard to find a part of the body that's not affected by it. It can cause heart attacks, strokes, type 2 diabetes, mouth, gum, tongue, head, and neck cancers, among other cancers. Can rapidly age the skin. It can decrease your sense of smell. It can damage men's sperm and decreases estrogen in women. It heightens the risk of dementia. And children who live with smokers have a higher incidence of asthma, ear infections, and lung infections. So let's face it, if you smoke, you stink. Your breath, your hair, your clothes. So if you quit, this will change. That chronic cough that you may have will disappear. Your teeth that are so yellow and possibly turning black will become whiter, and along with your skin being brighter. You will get back so much more energy. After one day, your risk of stroke and cardiac problems will decrease. After 1 month, your lung function will improve. After 1 year, your risk of CAD drops by 50%, and after 10 years, your risk of cancer drops by 50%. A tobacco-free environment helps create a safe and healthy workplace and campus. People who are bothered by secondhand smoke will not be exposed to it. And workers in a smoke-free business take fewer smoke breaks and they become more productive workers. And it will lower the healthcare costs. So be a good role model. Children whose parents smoke are more likely to smoke themselves. So don't smoke. If parents abuse alcohol or drugs, their children are more likely to do the same. Children whose parents have a healthy self-esteem tend to be more confident and hold themselves in higher regard. Children raised in homes that experience frequent domestic violence are more likely to either abuse their spouses or be abused by them. Children of happily married parents tend to find the same satisfaction in their relationships. Behavioral change theories are attempts to explain why there are behavioral changes. Pre-contemplation. At this stage, the person is not even thinking about the behavioral change. They may be unaware of the need for change or may be in denial. Contemplation. Once a person reaches contemplation, they may seriously consider the pros and cons associated with the change. The person may do some research and may learn more about the aspects of the behavioral change. Preparation. For smokers, this may involve a mental preparation of quitting smoking. Action. Implementation of the change in behavior. Some give up and others get motivated. If they fail, they'll usually go through the stages again. And maintenance. This is when they maintain the change in behavior and incorporate it as a new way of life. But many smokers relapse and may take many efforts to quit completely. To motivate the change, ask yourself, do you think you have any problems? Contemplation, ask yourself, what are some things that can help you make a change? Preparation, write down your goals like smoke less each day. Action, reward yourself for successes you achieve. Maintenance, develop coping strategies in case you fail. And relapse, identify triggers that lead to the relapse. Not quite ready to give up smoking yet? Try the daily challenges and practice quit text messaging programs through smokefree.gov. Sign up for text and daily challenges for 1, 3, or 5 days. Our campus is also teaming up with the Medical Center to offer daily quit smoking group sessions and free or low-cost nicotine patches. Come check it out. And the best thing, if you smoke 1 pack of cigarettes a day at $5.75 a pack, in 1 year, your savings can be up to over $2,000. So don't let your nest egg and your health go up in smoke.